Good morning, everyone. I'm Alaa Taj from Education Zone. I'm gonna introduce myself and what we do at Education Zone, and then I will speak about some pharmacy programs and around the world, the universities you can go into to study pharmacy, and then the entry requirements to enter these universities. Okay, so what we do at Education Zone is we do career counseling for schools, high school students, for even university students. We do university and college consulting and admission. We place the student at the university or college that he wants or she wants to go to. We do summer activities. We also do language programs. If you want to study English, Spanish, Italian, we place you at a language that will teach you the language at the same country. Okay. We do psychometric testing for career advice. This is specifically for students who don't know what to study or a bit confused. We can do this test and we'll give you a full report of the result and what career that suits you best. This is just some general questions to ask yourself if you're interested in, for example, pharmacy, sciences, business, anything else. Okay, what do you see yourself doing in the next 10 to 15 years? Because you will be studying for, let's say, 3, 4, 5 years max, but you will be doing your job for a minimum of 10 years. So is this really what you want to do? What do you love doing? What are you're passionate about? What are the modules that you enjoy studying? Do you enjoy biology, chemistry, or no, you enjoy business and maybe economics, finance? You have to decide the modules. What do you like to do in your free time? Do you like to do sports? Do you like to do business, like sell and buy? You like to do lab work? What is it that you like? Have you tried career tasting? Career tasting is a very useful tool for students to know, to find out about the jobs and opportunities out there. So what do you do basically is you go, for example, one day you go to a hotel, one day you go to a bank, one day you go to a hospital to see the jobs there and what offerings you have. And the last thing is the simplest things you can do is have you ask people about the nature of their job. Like asking people and knowing the nature of their job, what do they do daily, will give you an idea if you this is what you want to do for your life. Okay. So speaking of pharmacy, and since you're attending the PharmaCC conference, I thought of bringing up some subjects that are related to pharmacy. Okay. So first of all, we can speak about the pharmaceutical sciences. What is a pharmaceutical science degree? So basically, it discovers, develops, and analyzes medicines, explores drug discovery, pharmacology, toxicology, and examines the most effective ways that medicines are manufactured, packaged, stored, and administered. Okay? And also, they study the effect of drugs in living systems and the principles of immune system. Of course, they do a lot, but this is just a brief of pharmaceutical science. Next, we have pharmacology. Pharmacology that deals with the study of drugs and their actions on living systems, the study of how drugs work in the body, responsible for painkillers, caffeine drugs, and antibiotics. So, pharmacology is a research study. They study the medicine, how do they do, what do they do in the body, the effects of the medicine we take, discover the new medicines to help fight diseases, improve their effectiveness and reduce unwanted side effects, understand why some drugs cause addiction, and also understand the different effects on people. Like, for example, a person had this medicine and had different effects than another person who had the same medicine. So pharmacologists understand try to understand these differences and study the differences to come up with a new medicine for everyone. Okay. There's also cosmetic science. Cosmetic science provides an understanding of the chemistry and engineering components of pharmaceutical and cosmetic product design and manufacture. It is designed for students who want a career in the cosmetics and personal care industries. Okay, so they focuses on the needs of those industries and their consumers. For example, they focus on or they study how to make a lipstick, how to make a foundation. They work on creams, for example, sunblock creams, moisturizing creams, anything that has to do with cosmetics and, for example, makeups, creams, these kind of stuff. All right. It's very interesting, actually, and I'm going to tell you a bit about also chemical engineers, and they're relevant to pharmacologists or pharmacists. Okay, so in the design, or for example, the makeup of a cream or a lipstick or the things we mentioned, the foundation, etc., chemical engineers are also a part of the manufacture of these medicines or these cosmetics. So I came up with this slide to explain to you. Maybe you're more interested towards chemical engineer more than pharmacology or the other way around, because in a way they interact. Okay, so chemical engineers produce goods such as the drugs that pharmacists dispense to patients. Okay, chemical engineers work behind the scenes to develop new products and determine how products are made. They are producing prototypes, they are testing products, identifying ways to improve production, and creating safety guidelines. Okay? Pharmacists or pharmacologists, on the other hand, they do discover new medicines to help fight diseases. They improve their effectiveness and reduce unwanted side effects. Understand why people have different responses to medicines and why some work better for some people than others. Understand why some drugs cause addiction. Okay, so in a way, they both work in the same way. Chemical engineering is quite general, and they can work in pharmaceuticals, they can work in oil and gas, they can work in environmental sciences. It's a bit general, but they also help in the pharmacy production and manufacture. Okay, that's just an idea for you to think about if you're more, for example, interested in pharmacy and also interested in engineering. So they work together. Okay. Going back to pharmaceuticals and pharmacy, there's also pharmaceutical marketing. What do they do at pharmaceutical marketing is the strategies and market approaches in the pharmaceutical sectors. The marketing spend in the pharmaceutical sector has increased by nearly 70% in the past 20 years and now totals nearly $30 billion. So it's a big industry. Patients today require a different approach to addressing their health problems. So that's why we have mobile technologies, we have social media, the cloud, and the Internet of Things. Just some of the new realities that are disrupting healthcare today. Also, in the pharmaceutical marketing, we have now the digitalized pharmacy, where you just go, select your medicine and in a machine, and you will get it. So all these things related to dealing with customers, creating new ads, creating new things to attract customers and clients are all in the pharmaceutical marketing field. All right. There's also pharmacy management, and this is usually offered at a master's program, like a postgraduate education, but also as short courses. Okay. What do? They do pharmacy management, policy regulation, health systems, pharmacy leadership, and all the things related to management, managing the pharmacy, managing clients, managing inventories, ordering, purchasing, all these things. So you study customers care services, leadership, data control, positions and strategy management, retail marketing and promotion, human resource management and development. Many, many things to study in the management part. So you can do pharmacy as bachelors. And for example, you work in a pharmacy. You like working in a pharmacy, but you want like to do the or handle the management part of the pharmacy. You can do pharmacy management or pharmacy marketing. Okay, that's the thing we talked about earlier. There's also pharmaceutical research. So if you want to deepen your understanding, or you want to do more advanced research into pharmacy or pharmacology, you want to come up with new medicines, you want to do research on the medicines, you want to work with COVID and all these things, you engaged in research. So what pharmaceutical research does, it's designed to test the effect of medication or treatment in a group of volunteers, measures drugs' ability to treat the medical condition, monitor the drug safety and possible side effects. Okay. Pharmaceutical companies and other healthcare providers may sponsor research studies by providing funding and designing the protocol, which is a set of detailed guidelines, very strict. So trained doctors, nurses, and researchers conduct research studies, and they monitor the process day by day. And usually a doctor who monitors all these things and examines and supervises. Okay, so the Food and Drug Administration, the FDA, is the government agency that is responsible for research studies. It regulates the conduct of research studies, enforces the laws on the use of drugs, and must approve all new drugs before they are available to the general public. So after all this research, the result will go to the FDA to see if this medicine is approved or no. If not, they will do they do more research and see what's wrong. If yes, then it will be ready to use to the public. But this research goes by years, so it's not like 1 month, 2 months. No, the process take ages, and it's a very, very deep research they do. So what are the future careers if you study pharmacy, pharmacologist, pharmaceutical sciences? You can be a higher education lecturer. Of course, you need like a post-graduation certificates for this. You can be medical sales representative if you want to do marketing or sales or management part. You can do medical science listener, which helps the pharmacist or helps doctors and same doing research and working in labs, discovering diseases and all. You can be a pharmacologist. You can be a community pharmacist. You can be a hospital pharmacist, and you can be a research scientist. Of course, there are more, but these are some the things we found that it will be interesting to you. So what you need to do to be a pharmacist, you need to study. You need to get your education first. You need to get your bachelor's first. What universities or the entry requirements or the best place to go to depends on your, for example, preference. Whether you want to go to like a different country, you want to go to somewhere far away, or you want to stay, for example, locally, your budget, your results of school results or GPA. So all these things to consider. But the best universities for pharmacy in the world is University of Oxford, Monash University, University of Cambridge, University of Nottingham, UCL, Toronto, Sydney, Auckland, Trinity College Dublin. So as I told you, we have many universities, and all these universities have very good programs for pharmacy, but you need to decide on the university you want to go to based on your grades. Of course, you have to consider, because all these universities are top ranked. Some will need you to do A levels or IB. Some will you can just do a foundation year, and others will just need a high GPA. Okay. But looking at all these universities, you need to know if they suit your budget or no, if they suit your preference. Do you want to go to, for example, Ireland, or no, you want to go to UK, US, Canada, Australia? Where do you want to go? And do you meet the requirements and the budget requirement? Okay. Speaking of entry requirements, it all depends on the school curriculum you're doing. So for UK, let's say UK universities, you can enter the university with your IB or A levels, and you can do 3 years or 4 years program. If you are doing an MPharm, for example, Master of Pharmacy, integrated master program, you do 4 years. If you do Bachelor of Pharmacy, you do 3 years. But only if you are doing IB or A levels. If you're doing توجيهية or local school certificate, you will need to do a foundation year, or an extended, for example, A level program. In the UK, there is the option of doing that. So as I told you, UK is usually, the bachelor's program is usually 3-year program, but Canada, US, you do 4-year bachelor's degree. Okay, so even if you're not doing IB or A level, you still be doing, even if you're doing AIB or A levels, you still be doing 4 years of bachelor's. And of course, you have to take subjects that are related to the field you want to study in. So in case of doing pharmacy, pharmacology, you need to study or take chemistry and biology as subjects in school, in grade 10, 11, and 12. Okay. Of course, you need to get high GPA. Top US universities require SAT score. If only the top, like the top ranked ones. Some universities, they don't need SAT, they will just consider your GPA. Personal statement and recommendation letters are required in most cases. What is a personal statement? A personal statement is basically a statement explaining why you want to do this course, why you're interested in this program, what extracurricular activities or anything you've done related to the field. For example, pharmacy, what have you done? Have you like shadowed a pharmacist in a pharmacy? Have you helped someone in need? Things that are related to the subject you're going to study. And you also mentioned about your future plans. For undergraduate, a personal statement usually takes 1 page, 1 A4 page will be enough. Recommendation letters you can get them from one of the teachers at your school, or even if you have a professional work experience, you can get that as a reference. Okay. So this is the end of my presentation. If you need more information, or you want someone to contact you from the eZone team, you can fill this form. I don't know if I'm able to share my presentation, but however, you can email me any questions you have about entry requirements, about the programs, universities, anything you're concerned about regarding education, and we'll be happy to help. So I don't know if Natasha, we have questions, or can we?
Yes. Thank you, Alaa Taj, for such an informative session. I do have a question. I just wanted to ask if you could give any advice or pointers to a student who wants to begin their degree or their degree journey in pharmaceutical studies.
Sorry, what's the question?
What advice would you give for a pharmacy student or person who's starting into?
Like they started already,
No,
or
they're about to start.
okay, they're about to start. Okay, so do first of all try to do voluntary work or try to do shadowing work, anything related to the field you want to specialize in. So in case of someone who wants to do pharmacy, why not go and work in a pharmacy for 1 week, like, let's say, even if it's not paid. It's highly recommended for students to see the nature of the job, and if they are feeling okay, this is what I want to do, or no, I want to change my mind. Because, as I explained, you study the subject for 3 to 4 years, you will work for it for like 10 years. Is this really what you want to do? Or otherwise, you will like study and then, okay, this is not what I want, and you will repeat the whole process. So, try to do shadowing, career tasting, voluntary work that will help you understand if this is really what the student wants. And also prepare early. Prepare early, like if you doing, yeah, do the IELTS, because all universities will need, especially the universities that teach in English, you will need to do the IELTS. um, Start on the personal statement, get your recommendation letters, and ask for help. Seek advice from us, from your teacher, from your school counselors. Yeah, start early and prepare early. Yeah.
Thank you. We have another question. What kind of approach should you take in considering a postgrad degree, and how do you evaluate the future aspect of the degree, and how will it be working in 10, 20, 30 years from now?
Okay, so in case of, for a postgraduate degree, since you've done the undergraduate, I think a student at this point will have an idea of what he wants to do as postgraduate, right? Do I want to do, for example, teaching in a university? Do I want to do research? Do I want to do, I'm speaking of pharmacy here. Do I want to do more studies and just, for example, okay, I've done pharmacy, now I want to do management. So I think at this point you will find out what you need or what you want, especially if you have started working, because working in the same field will give you an idea of, okay, this is what I want to continue in, this is what I want to do. And for example, okay, I want to deepen my understanding, or I want to get more certificates in this field. So yeah, if not, then maybe look at options, look at universities, like, look at the courses, speak to people who are doing postgraduate, and ask for help, ask for advice. I think, yeah. And also browsing the university websites, you watching YouTube videos about it will absolutely help.
True. One more question. Would someone who is not a pharmacy graduate be eligible for pharmaceutical marketing?
Yes. And yeah, especially if as a postgraduate, because pharmaceutical marketing will focus more on the marketing aspects and the management aspect of the pharmacy. So you don't have to be a pharmacist, or you don't have to be holding a pharmacy bachelor's degree to
Bachelor's.
gain postgraduate, yeah, pharmaceutical marketing.
Lovely. Thank you so much, Alaa.